Welcome to today's Talking Tinnitus. In this episode, we're going to be talking about what the common issues people with tinnitus experience. And back again, we have Dr. Gail Brenner. Very welcome again, Gail, to the show. Pleasure to have you. So let's jump right in. So what are commonly some of the other conditions that people with tinnitus experience?
So many times, patients with tinnitus suffer from insomnia, difficulty sleeping, difficulty concentrating, having difficulty at work. They tend to want to isolate because it's very hard to concentrate on being social. They don't have that same kind of zest for life. They they don't feel like they have the same kind of control over their lives. So it can be very, very stressful, anxiety provoking for them.
Yeah. As a clinician, how do you maybe find your way? I suppose there's a unique maybe challenges that each of those pose for different patients. And is that a kind of a way to finding what's the best approach for an individual patient, maybe when they come in and talk about some of these challenges they're experiencing?
Absolutely. Every patient is an individual and every treatment is very personalized. So it depends on how they're doing and what they're doing. I coach them along, and treatment is very, very variable from, linear and education and mindfulness. It's all working synergistically to help the patient along. And sometimes multidisciplinary team is really important. And, it's really being that coach for the patient, that support person for the patient to help them through their journey.
Interesting. So for patients who do come into your audiology practice with tinnitus and it's bothersome to them, is it likely that they're experiencing some of these other issues around sleep or anxiety or concentration? I mean, it's probably rare that they're seeking treatment for tinnitus without that kind of impacting. It's almost probably that rare if it isn't that way.
Yeah.
Is that a fair assumption?
Such a good question. Well, statistically, 50 million. And now what I understand from the CEO of American Tinnitus Association, we may be closer to 70 million Americans who have tinnitus.
Wow.
However, 75% of those who have tinnitus are not necessarily bothered by tinnitus, which is the good news. So that says for those who are very disturbed by their tinnitus, they can be helped. It doesn't mean that they have to continue to be disturbed by their tinnitus, that there is help out there. This is a good time. It sounds crazy, but it is actually a good time to have tinnitus because there's so much that's available to help them.
Yeah.
So, so the patients that come through my office are seeking help.
Yeah.
And there's so much that can be done to help them. So they can get their lives back. They can reclaim their lives and have a normal life again. And their tinnitus does not have to be intrusive and affect their lives and affect their sleep and their work and their relationships.
Yeah.
It's wonderful to see the transformation over time.
Yeah, we're making progress together. The tinnitus ecosystem is making progress.
Absolutely.
And maybe that's a brilliantly positive message. Is if you're really bothered by your tinnitus, you're struggling for sleep, you're anxious about it. There's other people out there who are in the same boat. You're not alone.
Not alone.
They've gone to seek treatment and maybe they've been able, to manage it and have a better quality of life.
Yeah. Absolutely.
Are there other conditions, Gail, that are common too? So, hearing loss is always touted as being there's a common overlap between hearing loss and tinnitus. Things like maybe misophonia or hyperacusis. Are these quite common, commonly crop up in patients who come to you for their tinnitus?
Yeah, another good question. There are perhaps about 50% of people that come to the office that do have some, and I'll call it decreased sound tolerance.
Sure.
They walk in and they say, well, I have hyperacusis. Well, It may or may not be hyperacusis, but they may have some decreased tolerance to sound associated, either a fear of sound or truly a hyperacusis condition that may be associated with their tinnitus.
Okay.
Misophonia is a completely different condition that's not necessarily related to volume of sound, but related to how they perceive or relate to sound. It's a very different condition than hyperacusis.
Sure. And so I think the message there is that for any given individual, as you stated, they might be very stressed, very socially withdrawn because of their tinnitus. That might look a little bit different for everybody, whether it's with friends, with family, with work, sleeping. And then if you have these other kind of comorbidities and conditions too, it really is, if I suppose if you're interested in finding out more about your tinnitus, treating it, managing it, it's likely that you have a relatively unique story and that you should go to an audiologist to kind of figure out how to best write a happy ending to that story.
Absolutely. Okay. Seek an audiologist, and particularly an audiologist who has training in treating patients with tinnitus.
Yep. Super. Okay. Thank you very much, Gail, for that today. And thanks for joining Talking Tinnitus again.
Thank you. My pleasure.